Director, Dr. Emanuele Capobianco, Director of Programs at the WHO Foundation. Emanuele, always a pleasure to have you on the News Hour. Listen, what about this issue of patents? Because a lot of people in Africa, and they're medical experts, they say if those patents were lifted, we in Africa as a continent could produce the vaccines and it would be a game changer. Is it that simple?
It's maybe not that simple, but that's a big component. The World Health Organization has been very strong in saying that if manufacturing capacity is moved to African and other low-income countries, the availability of vaccines will dramatically increase. So that's one critical component that will help blocking this pandemic in a shorter period of time, will also be an investment for future outbreaks. Let me just add another thing. We need to accelerate the donations and expand the amount of vaccine that will be donated to countries. That will be a measure that could provide vaccines to many countries at the moment in Africa have received very, very little compared to the rest of the world.
Is it possible to put a figure on how many vaccines are potentially going to go to waste? I see numbers all the time. I never quote them because I'm not sure of the veracity of the source, but some of the numbers I've seen are that hundreds of millions of doses are going to go to waste.
No, the system and the World Health Organization has been very strong in strengthening capacity of the receiving countries to use the vaccines that arrive without wasting any of the doses. And the problem here right now is that there are no vaccines. We are aiming at having 40% of people vaccinated in African countries by the end of the year. In order to do that, we need almost 500 million doses to arrive, in addition to the ones that are already planned in Africa. If we don't get those vaccines there, we're going to reach 17%, which means that a very large part of the population will remain completely unvaccinated by the end of the year. That is the problem. The problem is getting the vaccines into the countries and then supporting the delivery, which is complex. And I think there are a lot of partners on the ground that are ready to support the delivery. But without the vaccines, then it is going to be very difficult.
Okay. Are you able to confirm that some of the wealthiest nations in the world have enough vaccines to administer in double doses for even 1.5, if not 2 times their entire populations? In other words, they've got excess.
Yes, there is plenty of excess vaccines around the world in the rich countries that can be redirected to low-income countries in Africa and elsewhere. And donations are happening. So there are a lot of solidarity that rich countries are demonstrating towards poorer countries. And this is very positive. What we are asking, both the WHO and the WHO Foundation that I represent, is to increase the amount of vaccines and speed up the delivery, because we are in a race against the time if we want to stop this pandemic. And while the Western world has coverage rates of 60, 70, even 80%, Africa is down at 4%. And we are aiming at getting them to 40% by the end of the year. And we need to go there, and we need to go even beyond that as fast as we can. And solidarity is central to this.
Yeah, and it's also solidarity, of course, Emanuele, because as people like you and the experts have been telling us, the whole world needs to be vaccinated for everybody to be safe. We're going to leave it there, Emanuele. Always a pleasure, as I said. Emanuele Capobianco from Geneva.